I hope we come out of this stronger and with more of a knowledge of what public health does and just how many lives are saved. You look at how few seniors are dying now as compared to what it was in the beginning. Having an infrastructure of public health and collaborative partnerships directly saves lives. When we do 500 or 1,000 vaccinations in a day, we know somebody, we don't know who, but somebody out of that 500 is going to live because of this.
Welcome to 20-Minute Health Talk. I'm your host, Rob Hoyle, and today's special guests are Dr. Maria Carney. She's the Chief of Geriatrics and Palliative Medicine for Northwell Health. And today we have Dr. Lawrence Eisenstein, who's the Nassau County Health Commissioner, and we're talking about older adults and COVID. It was such a scary time. So many older Nassau County residents are really affected. How is our senior population on Long Island?
So I will just start off by saying Nassau County is one of the older, has the largest percentage of older adults than many other counties in the nation. And I first saw that when I was at the Nassau County government in the position of Commissioner of Health that Dr. Eisenstein now holds. I remember getting calls from all these individuals at times of crises that were older, maybe not with family support, frightened during these times. And so that's one of the reasons why I went into to be chief here for geriatrics and palliative medicine. I wanted to kind of focus efforts, programs for this population. And boy, did we see it with COVID. And with Dr. Eisenstein and I staying in touch, we've been living through some incredible times. So yes, the population over 65 was greatly affected, had the highest mortality related to COVID, highest hospitalizations, skilled nursing facility populations were affected, but they were the first to want to receive vaccination, eagerly trying to get the vaccine, and now I think we're approaching almost close to herd immunity. Over 70% at least have received one vaccine, if not higher to date. So I'm very encouraged, but we have a population that is younger, that are vectors, and at risk of spreading illness if they don't get vaccine.
Yeah. Dr. Eisenstein, I think you said 80% of older adults in Nassau County have been vaccinated. Is that correct?
Yes, and it's a little bit even higher than that. We think it's about 81 or 82%, and it's reflecting in the data. We keep track of every positive case. We know the age ranges. We do a weekly evaluation, and we have seen people over 60, over 50, even the older people have had less cases, and that's because they're vaccinated. For a long time, we would see cases pretty much spread throughout the age diaspora, from young kids to all the way up to 90 plus years old. Now we're starting to really see very few of our newer cases are over 65 years old. Very few, maybe 2% or something like that, 3% on a weekly basis. Used to be 10, 12, 15%. And it would be 10% for every decade of life. It's clearly shifting younger. It's clearly shifting to the populations who are not yet vaccinated. And that's how we're going to, re-strategize as a public health department. But this goes to the seniors being willing, coming out. And there were times in the beginning when we didn't have enough supply. It was sad. It was frustrating that there were, in some cases, a husband or a wife was lucky to get an appointment and the other didn't. And they were very upset that we didn't have a dose for them. We were upset that we didn't have a dose for them, but we had to honor the appointments that people were lucky enough to get. And if you consider that we first started vaccinating, medical professionals in mid-December, it's late April now. It feels like a very long time, but when you look back at this historically, this is a miraculous response. And these vaccines are miraculous in how well they're doing at preventing disease and being safe at the same time. It feels like a very, very long time, but in infectious disease terms, this response has been really, really great.
We've even seen it dramatically in the skilled nursing facility population, where at first were the first outbreaks in Washington State and then in our region too. That population has been vaccinated. We're making great efforts that people getting discharged from the hospital that go to a skilled nursing facility get their vaccine upon discharge. The numbers of cases, outbreaks in skilled nursing facilities have dramatically decreased. If you could picture the curve from being very high to a steep decline, we are in a very good position with skilled nursing facilities in controlling outbreaks.
Right. Is that the number one thing for people who are in nursing homes is the most important is just to get that vaccine?
If you are in any kind of congregate living environment and you need assistance where people have to help you or bring things to you, whether that be a skilled nursing facility, assisted living, or you live in a community where you may be sharing areas of dining and so forth. So any congregate living, that is a population that must be vaccinated to prevent outbreaks. There have been reports that the second dose is being decreased or not being taken up, but I'm not sure how that compares across the age groups. I will say that in my patient population, they have been, may I use the term, religious about getting that second dose.
And in Nassau County Health Department's pods, I have the numbers. I just was going over this yesterday. It's over 99% of all first dose people came back for their second dose. I've read what you've read about other locations where it's not as much. And I assure you, part of that is the work that goes into it. And I know Northwell does the same. If somebody doesn't show up or they're an hour late, we call them. So there is a public health role in making sure that people remember that if they had a concern, you answer their concern. So it has been work to get it done, but we are over 99% of our first dose recipients coming back in all age groups for their second dose. And then the numbers support it. When you look at these vaccines, they are proving still to be well over 99%, close to 100%. We never say 100% in medicine. We try not to because then there's always an exception. But they're well over 99% protective against death. What else can you do other than lock yourself in a room and not be exposed to anybody or anything, which is not realistic? What else can you do that gives you close to 100% protection against death? So in my opinion, yes, by all means, vaccination is the way to stay alive through COVID.
Yeah, I think one of the things during this pandemic, the toughest thing was being isolated, not being able to see loved ones, children, grandchildren. Now that's happening, but the kids now, or the young people who just became eligible, are now the key to us reaching herd immunity.
The younger population are the vectors. They're spreading it they're social, right? So we have to keep population as safe as possible. And I think of my patients who have their grandchildren or their children really should be getting vaccinated to prevent illness in their loved ones. And I hope the younger generation can see it as that they have a role to help prevent illness amongst their social network, their family network. And I want to commend Nassau County. You did things very early, ahead of many other counties. For example, when many patients had trouble navigating the websites, the internets, you created a phone line where they could call and you would help them register their vaccine. So you've been creative and innovative of how to make vaccine accessible to help the older adult population.
Thank you. And our team is great. And you know, the health department, human services, IT, police, Homeland Security, OEM, we've all worked together. But it's great being the health commissioner here in Nassau County when you have the healthcare infrastructure that we have. And I'm not saying this because this is a Northwell-based podcast, but it's a fact that we have one of the great health systems in the world here in Nassau County, and we really worked well together. It has been a team effort across the county with all of our health providers. And, you know, it's not accidental that we have the highest percentage of vaccinated adults of any large county. It's been an around-the-clock job between ourselves and our healthcare provider partners like Northwell. And we really have seen just an eager population to come get vaccinated, and we're very excited about that.
And I hired him.
Yes, during H1N1.
That was a good move.
During H1N1.
But you also mentioned that Nassau County has one of the highest population of older adults.
We do. We have one of the highest populations of in the county compared to other counties in New York. We have pockets that are over 20% of over 65-year-olds. But on average, we're about 16% of the population is over 65, and that's higher than most counties in New York.